Healthcare for us continued to escalate. Every year, it would come about the same time. Our business manager would come to me and just say, looks like healthcare is going to go up 28%.
We were going through the cycle over and over again of being hit with outside conventional healthcare plan costs, and the renewals that would come up every year. It was not unusual to see 20 and 25 and 30% cost increases, which were just unbearable at the time.
Finances are important to the church from the standpoint of stewardship, being good stewards of our congregation's donations, and trying to maximize every dollar that we have that we've been stewarded with to do ministry.
With conventional insurance, we just didn't see, the type of service, we didn't see the return that we felt we should get, and we were open to other alternatives.
Pete McQuillan came to me and said, what if I look at health care, which costs the church $500,000 or $600,000 a year? I've looked at this alternative. It's called CHM. I think it could save us $250,000, $300,000. And I'm like, let's do that tomorrow.
We did a lot of research to make sure we understood the program, all the parts and pieces that go with it. Most of our vetting was done talking to the other churches that were part of the program and spending really literally hours on the phone, finding out any pros, cons. Learned more and more about CHM. I took it back to our leadership team to consider. They had the same idea that I had originally, that it was second rate. They came to realize over time as they got more involved what a treasure CHM is.
It took a long time to make a solid decision that we wanted to move forward with this plan. We had a lot of doubts. We wanted to talk to an attorney about how the whole plan would work together. But once we could begin looking at some of the other surrounding pieces to soften the administrative burden, to cover the gaps in coverage that I saw there, the whole business mechanics behind trying to make that work. With CHM as the centerpiece, it started to look at something really solid that we could move forward with and make work for our team.
Moving to a plan where you're going to share expenses with CHM, there was definitely some questions and fears that we had about how it was going to work for the employees.
So we continued to kick the tires, and after about 2 years, I got a call from a lead pastor at Village Church who said, Pete, you can keep looking at this and looking at it, but at some point you're going to have to take the plunge. But there's no reason to be afraid. The benefits to the kingdom will be enormous. I tried to take that same confidence to Pastor Coffey and to our elder team to let them know that it's not just us, but there's other churches that have gone and taken this step of faith and have found great success and have been able to do wonderful things like put in church plants, stretch ministry dollars to do more ministry and build the kingdom. The timing couldn't have been better. With CHM coming on board, the savings came at just the perfect time. We've just experienced wonderful blessings over the past 3.5 years.
We were kind of blessed that a lot of this was local to us, so we were able to get to them easily and check out the depth that they had to support the claim process and what was behind CHM.
So we utilize a third-party administrator to handle our HRA benefits. Because of the HRA component that we offer, it was going to be very difficult for us to manage that, and so we utilize EGP to be able to help us out with time management, and then it's cost-effective for us as a large church.
So we work very closely with Christian Healthcare Ministries, along with the attorney, Jeff Zyman, so that we can take that load off of you. The three of us make the whole plan work. Jeff draws up the legal documents, and then once that is put into writing, we go ahead, build the plan accordingly, and we administer that plan.
A large part of our practice is working with Christian organizations to develop Affordable Care Act compliant group health plans. They come to us with a need to provide good group health care plan coverage to their employees. They love the idea of working through Christian Healthcare Ministries because they're sharing with fellow Christians. But they want to do it in a compliant way. We walk them down the pathway of developing a customized program that meets the requirements of the Affordable Care Act and the tax laws, so they provide a non-taxable benefit to their employees that is valuable, and that also is valuable to them because they can receive and give. It's a win-win. That's why there are so many groups that are so successful.
At first, when we rolled this out to the staff, there were a lot of questions. When they put the puzzle pieces all together, it made a lot of sense for them then. They could see that everything would work well, much like a conventional plan might, but different because it was self-funded with all the benefits that went along with that.
The special thing about Christian Healthcare Ministries is they've designed a sharing structure where like-minded people come together, bear each other's burdens. They have rules and principles. They have published them so everyone knows the rules of the road. And then we can take that into a group health plan setting, comply with the law, provide non-taxable benefits, and it works.
When you bring a concept like CHM to a church staff, you're concerned that you're looking for a change that could harm any of the staff members or the reputation of the church. We thought long and hard about that, prayed that this decision was right with the Lord, and that was probably the biggest concern we had, was taking a misstep.
It was very obvious that there was nervousness there. And when we first opened it up to asking all kinds of questions, the hands popped up all over the room. And the good thing was having Christian Healthcare Ministries there, having our third-party administrator there on site, but we were able to answer all the cares and concerns that they had.
We were definitely skeptical about CHM, but CHM has surpassed my expectations, and I feel really comfortable saying to anyone who would ask that CHM is a great option and really should be considered. Not only the money that you can save, but the ability that you're going to be able to impact other people's lives. And just for us as a church, we get to do more ministry with those dollars that we've saved.
CHM has allowed us to provide health care, and the savings with CHM allows us to plant a church every year because of that money. That neighborhood now has a gospel-preaching church. If you want to repurpose dollars for ministry, CHM is one of the best ways to do it.